My name is Craig Spears, and I'm an ambassador for NC UK, using the patient voice to help create awareness of living with this uncommon cancer. I've been living with neuroendocrine cancer for 7 years now. My primary is my rectum, with mets to my liver and abdomen, and I have both carcinoid syndrome and carcinoid heart disease. My presentation today discusses working well with your medical team, dealing with your complex condition while trying to maintain as much of a normal life as is possible. I'm going to start off by looking at my medical team. Over the last 7 years, the team around me has grown, as is normal in the treatment of NETs. From the initial visit at the Beatson, I now see multiple consultants. As you'll see on the screen, each of them has helped me to maintain the quality of life. This, for most of us, is what's important, the ability to live life as normally as we can. Every month, there's an appointment. This could be a scan, blood works, treatment, or a consultation. The constant trips to the hospital can be tiring, and managing this with your day-to-day life can be stressful. Let's look at some of these and the role they play. Firstly, our GP. Although not involved in our treatment, this for most of us is where it all began. My initial relationship with my previous GP was not great. Years of back and forth with symptoms and getting nowhere close to a diagnosis. My new GP changed all this, and thanks to them, I got the diagnosis I have today. Before COVID-19 kicked in, I'd arranged to speak to the GPs in my practice. Unfortunately, this had to be delayed. We should take all the opportunity to speak to those involved in our care and help them better understand this uncommon cancer. My oncologist is Professor Reid at the Beatson, along with the specialist nurse Irene Witherspoon. And together, they've been instrumental in guiding me through this last 7 years. During this period, I've developed a good relationship with both of them, and I now feel at ease in any appointment with them, free to discuss anything that concerns me. My cardiologist. I have carcinoid heart disease, and as such, both of the valves on the right-hand side of my heart have become damaged and need replacement. I've now accepted that this is part of my new life, with regular appointments and the weight of further heart surgeries. I joke that going to the Golden Jubilee is like my MOT. I have an echo and an ECG, and thankfully on the last visit, I required no work, which is always a good result. I have yet to muster the courage, like some of you, to self-inject. For those that can, I tip my hat to you. I can see the benefits of doing it yourself and having a partner do it. You gain back some of the control, but it's not something I think I'll be doing anytime soon. I'm lucky. I have one nurse in my GP practice that's been trained, and most importantly, I trust her to inject me. No matter where you have the treatment, if the injection is administered correctly, then the rest is a personal preference. The team is important, but where do we all fit in? I asked a group of patients to tell me what they felt were the problems that held them back from working well with their team. On looking at the list, I can agree that there are points in my treatment where I've had similar thoughts to these. When I think back to the first few meetings, most of it's a blur. I arrived with my wife, and while waiting to go in, my mind was full of thoughts. Like, how long do I have to live? How will my wife and children cope without me? The fear had taken over me by this point. I was no longer in a place to listen, never mind remember all that my team had to say. When I look at the list, I look back at the time and I think about how much I've moved on from this negative to a positive relationship I now have with my team today. Some of the points that stood out were a patient feeling stupid for not understanding, trying not to worry family members, a doctor's use of medical jargon that we don't understand, and playing down our symptoms. These are all feelings that I'd had in the beginning, not knowing what to do to move past this. I thought my time was up even before my first consultation. It's natural to fear what we don't know. So what can patients do about this? Support and talking with others is important. Educating yourself. Ask questions. Keep a daily diary and managing your appointment. So looking first at support. Look for support. It's all around you. First, your family. This is, for most of us, is the backbone of our support structure. In the early days, my wife and sometimes my mother came with me to my appointments. This helped them to be there for me if I needed support, but also helped them to learn about this complicated life. Another reason I brought my family was until this point, I had very little interaction with doctors in my life. Much of what they said, I couldn't remember or understand, and I didn't yet have the confidence to speak up. So having another set of ears helped us. We would talk about it together on the way home and digest together what we'd been told. We sometimes tried to protect our family from the reality of this life. I found that by including my support in my appointments, they were better placed to understand when I needed them. I also monitor other patients on social media, discuss their hospital visits and how they gained the support from each other simply from being in a similar position and understanding. This is what's great about social media. You find others reaching out to strangers in the hope that what's said can help make a difference. If you have a strong support structure, be that friends, family, patient support groups, often they provide a missing piece in your jigsaw. The net natter groups are great. Sometimes we just need someone to listen to us, share their experience, and let us take the comfort we can from knowing that someone else has been down that same road. My experience of the support groups is there's always someone willing to listen, and these people understand what it's like living with cancer. We regularly talk about scans, treatments, and our appointments, all supported by Nikki from NCUK. Sometimes it's just a chat with friends, remembering we all still have a life after a cancer diagnosis. During this period of COVID-19, the landscape for face-to-face meetings is not possible, unless, like me, another patient lives a few streets away. However, NCUK has set up Zoom meetings, which is a safe place you can come to speak to patients, old and new. The calendar and registrations is on their website. Another area is education. No matter what we all think, we are never too old to go back to school, and this is a must with NETs. The language that's used by doctors can on occasion be unfamiliar to patients or supporters. We can help our medical team by learning. This helps you to advocate for yourself and others during your appointments. There are many places a patient can go in search of information, but unfortunately, most of these are either out of date or just incorrect. So where are the safe places to go? NCUK has recently launched a new website, and it's packed with all the resources you need when discussing your treatment. There's also a website by Ronnie Allen, Living with Neuroendocrine Cancer, and various social media pages such as Friends of NCUK or Ronnie Allen's blog. A benefit of joining a support group is people openly talk about their worries, scans and treatments. You can choose to contribute to a conversation if you feel comfortable, or just follow and continue to learn from other patients' stories. A patient or supporter that has education behind them is in a much better place to contribute to their appointments and will give you the confidence to advocate for yourself and others. There are also times in my treatment where I find myself in the position of having more knowledge of my condition than the people caring for me. This is an unusual position to be in, but one I would encourage you to always take advantage of. We all get frustrated by this, but if we want things to improve, we should always be willing to use the patient voice to help educate others, especially when they're involved in our care. Ask questions. This, I feel, is one of the most important parts of working with your team. You only need to look at the social media pages to see how many questions we all have. It made me think, what's stopping us asking these questions during our appointments? Well, maybe we don't yet know the questions to ask. We're intimidated by our team, or we feel we would be taking up too much of their time. I know there was a point when I could say yes to these. So what did I do about it? NCUK has a list of questions on their website. All patients should ask these at diagnosis and after treatment or monitoring appointments. The feeling of taking up too much of your team's time I get. The waiting rooms are often busy and they rarely run on time. A patient can feel the pressure of this, like they only have a specific amount of time with a consultant. We all know the stress the NHS is under, and I'm sure your team would rather give you more time than you leave with questions unanswered. Prepare for your appointments. Ensure you write down any questions you have before you go. The figures suggest that patients forget between 40 and 80% of the information given during an appointment. So to help with this, you should take notes or ask if it's possible to record the conversation on your phone. This will enable you to take the information away. Then, when you feel less stressed, you can digest the information and write down any new questions that you now have. You can also request an email address from your nurse specialist. That way, any concerns or questions you do have don't need to wait until the next appointment. Keeping a daily diary. Keeping a daily diary is important, not just for you, but also your team. I keep a note of the foods I eat, what medicines I take, and when and what symptoms I have and their frequency. The reason I do this is so I'm better placed to explain to my team how I've been since my last appointment. It may well be that previously my meds were reviewed. I can now confidently let my team know if the changes have helped. We all know that what we eat can be a trigger for our symptoms. So if we document this over a period, we should be able to identify food triggers. There's work being done to look at an app for our phones. They can be used for this purpose. Hopefully, when complete, this will become part of our everyday routine. Managing an appointment. So what do I mean by this? I suppose I look at this like a meeting I would have had at work. Be prepared. You only need a little time to prepare for your appointments, and this can help you to leave better informed. Have your questions at hand and note down any points that you feel is relevant. Ensure your daily diary is updated and any changes noted to discuss. I try to get to my appointment early. Sometimes I have a coffee at the Maggie's Centre, which will help me relax. Emotions can play a big part in an appointment. My mind can be my biggest enemy at times, especially if I'm waiting on results from a scan. This is why I take support with me. We never really know what will be said at an appointment, so best to be prepared, and if nothing else, I have company if the appointments are delayed. After your appointment, discuss with your team what material they have, and if they have any suggestions, they can help you better understand or cope. So we're now working well with our medical team, but how do we deal with living with this complex condition? Well, first of all, ensure you have the best care. Managing a complex condition often means working closely with your healthcare provider. So it's important that they fully understand your condition. The best place to start is ensure you're being seen by a NET specialist in one of the UK's Centres of Excellence. Or, if that's not possible, then your treatment should be overseen by a specialist centre. There's a list of these centres and specialist clinics on the UK iNet's website, or you can just check with NCUK. Next, focus on you. You'll make lots of changes in your life after this diagnosis. Some of my friends say that I've changed for the better, and I'd probably agree with them. I had to think about what was really important to me. Aspects of my life were no longer helping me with my treatment. So I decided a change was required. The biggest change was I took a step back from my career to help me through my treatment. This gave me more time with my young son and daughter, who helped me every day to focus on what's really important in life. Every patient is different. If you feel you can't carry on with something, then don't worry. Try to fill it with something else. If one door closes, then another one opens. That's how I look at my life today. Try to maintain your health. In my early career, I was a Royal Engineer in the Army, and I took pride in keeping myself fit. Sadly, due to flushing and the issues with my heart, now I've found it difficult to maintain this level of fitness. The health benefits of staying active are well documented, and I'd encourage you all to find a level that you're comfortable with. This could simply be a short walk each day, or take up some yoga or Tai Chi, and for the more adventurous of you out there, why not take on a challenge for a charity? It really doesn't matter what you choose. Having activity to do regularly keeps you in a routine, and when done with others, can help lift your spirits. Join a support group. Give it a try. I would have said I was the least likely patient to attend a support group in the beginning, as I would have seen it as a weakness. I say it all the time, unless you live this life, you really don't understand it. The best support given to me is from my friends in the Glasgow Net Natter group. I was lucky enough to meet a great bunch of people who I now look upon as friends. Don't be afraid to hit the pause button. The last 7 years have been full of ups and downs for me, and I'm sure others feel the same. I'd encourage you to find a way to regain your thoughts before it becomes overwhelming. This life is tough, with scans, appointments, surgery, and treatments, and sometimes it feels like you just can't catch a break. By taking time to yourself, to do what you enjoy, gives you a greater sense of well-being. I recently spent 5 days away at a lodge with my wife, relaxing in a hot tub, enjoying peaceful walks together. It was bliss. These times are few and far between. When I see others on the group chats enjoying themselves, doing what they love, and exploring the world around them with their loved ones, it's something I should definitely do more of. Be accepting of your new normal. I'm 40 years old and I've been living with cancer for 7 years. This is something I'm no longer scared to say. I previously said in my Face of Net video that I'll live until I'm 80, that cancer won't beat me. We all have a way of accepting this new normal, and my way has been to talk about it, welcoming the support I receive, along with educating myself. By doing so, I take control of the fear of living with cancer, and I hope you get some benefit out of this today. Thank you.